On World Diabetes Day, Type Dia Beat It brought community leaders, health experts, and Black-led organizations together for Bridging the Gap. This event was about advancing Black health equity in diabetes care. The event focused on building culturally safe, trusted pathways for diabetes prevention and treatment in London's Black communities. Type Dia Beat It is pushing for policy changes including the recognition of Afro-heritage food in the Canadian Food Guide and hopes to establish a culturally competent community health hub in southwestern Ontario. Speakers from Middlesex London Health Unit expanded on the need for long-term partnership and structural change, while organizers called on institutions to turn commitments into action. Executive Director Mystery Furtado says the priority now is to deepen collaboration.
We've set the foundation and the groundwork, and we want organizations to know, partner with us, and amplify the work that we're doing.
Furtado says there are currently no culturally competent diabetes center west of Hamilton, and that needs to change.
For us in southwestern Ontario, we're hoping to have a satellite post, a satellite location, kind of doing the work that Taibu is already doing, but how do we make it more centralized?
Christian Debout, Manager of Health Equity and Indigenous Reconciliation at Middlesex London Health Unit, says the MLHU is committed to turn its anti-Black racism and Indigenous reconciliation strategies into meaningful action.
Over the last 4 years and more, the health unit has been advancing an Indigenous reconciliation plan and also an anti-Black racism plan, and they both are focused on addressing the structural barriers to serving Indigenous communities and Black communities as well.
The City of London's strategic plan also emphasizes health equity, food security, and improving access to culturally safe health services.
Really, after Hamilton, there is not very many there's none. Let me just be frank. There is no culturally competent centers, and the policy specifically is around an equitable addition, looking at the Canadian Food Guide for diabetics and how do we get Afro-heritage meals.
Community members can support the work by attending events, volunteering, and joining the collective shaping upcoming policy recommendations and program outcomes. So that was Bridging the Gap. Hopefully they'll bring more than just good intentions. For XFM News, I am Daniel Monroy.